Hello, my name is Chaplain Michael Aldouby. I'm a hospital chaplain in a large urban hospital, and I wanted to speak about my experiences of being a hospital chaplain during COVID in a large urban hospital. In the beginning of the COVID patients coming in, um, the hospital I felt was really overwhelmed. It was very scary in the beginning. There were also a lot of people who came to the hospital to be tested because of the big scare in the beginning. And the testing labs were overwhelmed. So often they would be put in rooms, in isolation rooms, where they were rule outs. So it sometimes took several days for them to get a result for their test. So when you had so many people coming in because they were scared, uh, put in isolation units with rule outs, it really overwhelmed the system. In fact, I had trouble finding where they put the regular patients because the COVID and the rule outs were taking so much of the hospital. Some parts they moved them to laboratories, but I kind of thought to myself, there has to be somebody who had a heart attack or other reasons that people came to the hospital other than COVID. So once there were COVID patients, it was a really a true scare. There were a lot of people who died. Um, One of the sad parts is visitors were not allowed into the hospital at all. So a lot of patients died in complete isolation, which was very difficult for the family and the patients and the healthcare team to see them die so quickly. Some nurses said that they saw patients, COVID patients, who seemed perfectly healthy one day, and then the next day they were on ventilators or not alive or died. I received several awards from the city, the county, the federal government for my work with COVID. However, I feel I did not really successfully have many successful visits directly with COVID patients. One reason for this is because I felt like when I saw a COVID patient, I almost had to dress like Darth Vader, with mask and then face mask and all the gear. And soon the hospitals were concerned about the equipment being used. So I kind of felt that the hospital and I, who understood the shortage, didn't want me to really see COVID patients themselves, which there was a real, true concern about shortage. And I found that over the phone, because I could call them from the nurses station, it didn't work. I didn't really have a meaningful visit. Um, I didn't really have visits with family because there was no family in the hospital. Everything would be on phone. It would be all, there were no visitors allowed. There was no family. So what I did is I focused on staff. Uh, Nurses were very scared. They were scared of not just getting COVID for themselves, but they were scared of getting COVID and passing it on to other people, like elderly parents or family members. So you had also nurses who slept up or probably still sleeping apart from their loved ones for fear of not getting them ill. Also, doctors feared getting COVID themselves, and they were concerned about whether they would have to make the decision whether to take somebody off a ventilator and give it to another person or ration it. To my knowledge, and I've asked about this did actually occur. I saw this almost as it being close to what a patient is going through when diagnosed with a serious illness. I often these patients have a fear of the unknown. I felt within the hospital itself there was a fear of the unknown among the staff. Will we be overwhelmed? Will we get COVID? What else will be happening? So I saw a parallel between what a patient goes through when diagnosed with a serious disease and what the hospital staff were going through all this. Um, so I spoke to nurses, I comforted them, I said prayers for them. I also found groups of doctors, and prayed for them and listened to them and gave them emotional and spiritual support. One thing they teach in chaplaincy school, clinical pastoral education, is not to push your religion on others. However, I found, especially in those times, that the staff, the physicians, even environmental services, they were all hungry for this and needed it for longing to for people to take care of the caregivers. Um, there's still COVID going on in the hospital, and it's still dwindling. But as for me personally, there were some chaplains who were told not to come to the hospital um, because they would take equipment, personal protection equipment. But for me personally, is my calling is to be a chaplain. And I felt in this war I could contribute in this battle to fight back the enemy, the COVID enemy. And for me, one of the worst things I can imagine is to be told not to come home. I'm sorry, not to go to the hospital. So I really truly feel blessed that I was there at the time that it really mattered. And I think for nurses and doctors, this was a really important time, and they really are the heroes. You know, the ones who are there who aren't sitting on the couch, and the ones who are fighting and pushing back on the enemy. So I just wanted to explore my own thoughts and experiences. I don't speak for my hospital, I don't speak for anybody else but my own insights. So thank you for listening. God bless you all.